Arthritis Unpacked is a patient education resource developed and owned by Janssen Australia. The content is created by Dr. Paul Bird with the support of Janssen. The information provided is for educational purposes and does not replace the advice from your healthcare professional. Always refer to your healthcare professional about current treatments, possible side effects, and other considerations. Paul Bird is an experienced rheumatologist and researcher dedicated to the expert management of patients with all forms of arthritis and rheumatic disease. As well as caring for patients in his clinical practice, he continues to undertake arthritis research with fellow Australian rheumatologists and international colleagues, ensuring he is up to date with the most recent medical advances.
Welcome to Arthritis Unpacked, a podcast series designed to help you understand your arthritis better and help you get the best out of your treatment. Join me, Dr. Paul Bird, an arthritis specialist, which is also known as a rheumatologist, as together we unpack your arthritis baggage, helping you navigate the maze of arthritis terms and treatments. Arthritis without the jargon. Arthritis made simple. Arthritis Unpacked. Thanks for joining me again. If you've been able to follow the first series, you now understand that knowing what type of arthritis you have empowers you. It allows you to know more about how that arthritis will affect you, what treatments are available, and what you can do to help yourself to get on the path to wellness. In the last series, we focused on rheumatoid arthritis. In this series, we're going to focus more closely on another type of inflammatory arthritis, psoriatic arthritis. Now, before we jump in, I wanted to remind you of a couple of important basics that'll help you understand as we unpack. Remember from our previous podcast that most types of arthritis fall into two main categories. The first type affects the cushion, the cartilage in the joint. Over time, the cushion or the cartilage wears down, the bones start to get closer together, and in the end, the bones rub on the bone. This is mechanical or wear and tear arthritis. We usually know it as osteoarthritis, which is the most common type of arthritis. If you play a lot of sport, you might be prone to it, and you might know someone who's had a joint replacement for osteoarthritis, so that's a pretty simple concept. The second category affects the lining of the joint, the synovium. That lining produces a lubricant fluid in the joint. Rather than being nice and thin, as it is in normal life, it swells up, gets boggy, and sick and starts gushing out lots of fluid into the joint. The joint swells up, and in most of these inflammatory types of arthritis, it won't hit one joint, it'll hit lots of joints at once. So in contrast to mechanical arthritis or osteoarthritis, the joint or joints are usually stiffer after resting or in the morning and improve with exercise. Also, the sufferer feels systemic symptoms, exhausted, fatigue, unwell. Included in this category are things like rheumatoid arthritis, which we've discussed previously, and psoriatic arthritis. Psoriatic arthritis is part of a group of conditions that we collectively call Spondylo Arthritis. These conditions are grouped together under one umbrella because they share common features. So before we go any further, let's unpack some of these terms so that you understand them. Strip away the jargon and put it into plain language. Like many confusing terms in medicine, spondyloarthritis has Greek and Latin origins. The term spondyloarthritis is an amalgamation of spondylo, meaning spine, and arthritis, meaning joint inflammation. Unpacked, this means that if you have one of the types of spondyloarthritis, you can potentially have inflammation in the joints like the knees, the wrists or the elbows, but also in the spine. The spondyloarthritis group of conditions are a broad group. Some of the illnesses within the group mainly affect the spine, with secondary involvement of the joints like the knees and the wrists. These are termed axial spondyloarthritis and include ankylosing spondylitis and non-radiographic spondyloarthropathy. The axial part in the name gives you the clue that the spine inflammation is the primary problem in these illnesses. We'll deal with these more in Season 3. Others within this group affect mainly the large joints and not always have spine involvement. These are termed peripheral spondyloarthritis and include psoriatic arthritis, reactive arthritis, and inflammatory bowel disease associated spondyloarthritis. The peripheral part in the name lets you know that these illnesses primarily affect the peripheral joints. Let's pause there for a moment before we move on to discuss psoriatic arthritis in more detail. To help you understand how the spondyloarthritis group of illnesses affect you and your family, we have to go back to that joint anatomy we discussed in Season 1. Because the spondyloarthritis group of illnesses have peculiar ways that they can affect the individual. And to understand that, we have to add to the joint that we built in Season 1. Let's go back and consider a knee. Now, the first thing you need in any joint are bones. In any joint, there are usually two bones, and that's the case in the knee joint. The top one called the femur, the bottom one called the tibia. There's a little bone in there called the fibula, but let's leave that out for now to keep this simple. So, femur at the top, tibia at the bottom, kneecap or patella on the front, and there you have it, the bones of the knee joint. Let's put a cushion in between the bones to protect them from damage. Cartilage is the cushion between the bones. What about some lubricant? We can't have that knee trying to move all day just grinding against itself without some fluid in there, so let's put in some fluid. And this is the third really important part of the joint, the synovium. I'll spell it for you. Synovium. Synovium is tissue paper lining. Imagine it sort of coating the inside of the joint all over and producing a small amount of oily lubricant fluid every day. Bones, cartilage cushion, synovium, and synovial fluid for lubrication. Let's add ligaments. Ligaments join bones to bones, and then we need some muscles to move it. That's a summary of the basics from Season 1. Now let's add some parts that are important in the spondyloarthritis condition. Tendons connect muscle to bone. You can see them moving on the back of your hand if you clench and unclench your fist. Like stretchy rubber bands, they are essential to movement. We have almost 4,000 tendons in our body, all over, connecting muscles to the bone and helping to move the joints. Each tendon has a sheath of lubricating fluid around it, filled with, you guessed it, synovial fluid, that lubricates the tendon as it moves. And importantly, where the tendon joins the bone, there's a special name, the enthesis, E-N-T-H-E-S-I-S. There's another Greek word right there. Enthesis means insertion or putting in. So, the enthesis is where the tendon attaches to the bone. As in any inflammatory type of arthritis, the synovium is inflamed and boggy in patients with spondyloarthritis, but importantly, and this is unique to these conditions, the tendons and the tendon insertion, the enthesis, also become inflamed in these conditions. This is enthesitis and tendinitis. The enthesitis can affect the peripheral joints and the spine. In the lower spine, there's also a special joint on either side called the sacroiliac joint, S-A-C-R-O-I-L-I-A-C. This can become inflamed, leading to stiffness in the lower back and pain. And the ligaments that connect the vertebra, the bony building blocks of the spine, can also be affected, leading to pain and stiffness. Now, beyond the joints, in cases of psoriatic arthritis, the skin is affected by psoriasis. Psoriasis is a Greek word meaning itching condition. Psoriasis manifests as a scaly rash that is a red plaque with a silvery scale. It can affect the elbows, knees, scalp, but can affect any part of the skin. The nails can also be affected in some cases, with thickening, scaling and breaking common. For some cases, the skin and nail involvement is mild. For others, it can be widespread and disabling. About 30% of people who have psoriasis will develop joint symptoms. Finally, in a small proportion of cases, the spondyloarthropathy illnesses can also present with extra-articular features, that is, features that are not in the joint. They are extra, beyond the joint. These include the inflammatory eye condition uveitis. We'll come back to that later when we talk about how psoriatic arthritis affects the joints and spine, but right now, if you can remember the enthesis and tendon is important, that's all we need to do. Remember these terms: spondyloarthropathy, spondylo meaning spine, and arthritis meaning joint inflammation. This is a type of inflammatory arthritis, and examples include psoriatic arthritis, ankylosing spondylitis, non-radiographic spondyloarthritis, reactive arthritis, and inflammatory bowel disease-associated arthritis. In the spondyloarthropathy conditions, the joints are affected so that the synovium, the lining of the joint, becomes inflamed and swollen, leading to stiffness of the joint, worse in the morning or after inactivity. In addition, tendons around the joints can also be affected, leading to tendinitis. A good example is Achilles tendinitis. And where the tendon connects the muscle to bone, the enthesis can also be inflamed, leading to enthesitis. The spine and sacroiliac joints can be affected, leading to stiffness and pain involving the lower back and the neck. Well done! We've unpacked the basics, and that foundation will set us up to help you understand these complex conditions. Now let's move on to discussing one of the most common types of spondyloarthritis, psoriatic arthritis. The next Arthritis Unpacked episode deals with psoriatic arthritis, one of the forms of spondyloarthritis. I'm Professor Paul Bird, and this is a podcast all about arthritis. Without the jargon, arthritis made simple. Arthritis Unpacked.